My name is Sarah Griffin. I am I'm operating room nurse of 22 years. I am the clinical coordinator at Boston Children's Hospital in the operating room in Waltham. So we are a satellite outpatient, mostly outpatient pediatric surgery. I am also a local chapter officer for AORN. For the 22 years I've been an operating room nurse, sad to say, but many of them have not been without incident of incivility. And through these lived experiences is where I've gained this passion to address workplace issues, and that also means incivility. So let's see, this is not working now. There it goes. A little bit of housekeeping. I have no disclosures, and this is the interactive portion. So the QR code is here. So if you could go ahead and scan it, I'll give you all a minute. And if it doesn't work, you can go to menti.com and it will ask you to put in those numbers, 21253783. It should be at the top of all the slides. So if you tend to go out of it, it's okay. You can find your way back. It was my phone. It's okay. Yeah, I'm good. So this can sometimes be a little bit of an uncomfortable topic. So this will kind of give you some privacy if you want to share experiences as we go along. So what I hope you get out of this today, I hope you can describe the differences between civility and incivility and understand the costs and consequences of incivility to our patients and our healthcare systems. Recognize some strategies that will foster civility in your operating rooms or even the perioperative environment. And I hope you're empowered at the end to implement some interventions and build some civility in your operating rooms. So, like many of you, I come from, I think a lot of nurses come from a family of nurses. Anyone? Anyone else? Yeah. I have a lot of aunts who are nurses, a lot of cousins. And so I decided that was not what I wanted to do when I went into college. So I'm not going to be a nurse. I want to go into biology. Well, by year 2, I realized I was wrong. I wanted to be a nurse. I have that servant nature. And so I switched from biology to nursing. It was soon after I started nursing school that I thought about the operating room. And I had this love for anatomy and physiology. When we were dissecting stuff in high school. Yes, I love that. I love that. So I thought the operating room was going to be a perfect spot for me. I thought it offered the ideal mix of anatomy and that hands-on care. It was exciting. Surgery is exciting. That added to the appeal. So two of my aunts at the time were going into the operating room. One of them was a maternity nurse, one of them was a floor nurse, and they both decided to make the change into the operating room. So of course, I called her while I'm in nursing school. I said, Aunt Sue, I think the operating room is where I want to be. I have been and done all the other inpatient stuff, and I just really want to be in the operating room. And she said, hey, you know, the operating room is a great place to work. She got tearful and emotional, and she said, I'm really sorry. I've had a bad day today. I'm on orientation, and the doctor, the thoracic surgeon I'm working with, he was just so mean to me. And so I'm sorry that I don't really have the right words today. But I will tell you, Sarah, you have to have a thick skin to be in the operating room. You need to grow a thick skin. If you can do that, you can survive here. So immediately, I was 20 years old. I thought about the times when, I don't know about any of you, but I started my scrub nurse career helping my dad, handing him tools. Anyone else? So I was very much used to my dad's frustration in the middle of projects when I'm handing him stuff and he's going, ugh. But what I didn't realize is in the professional environment, that hits a little different, right? different. My dad, I can handle. Professional environment, maybe not. So despite my aunt's warnings, I decided to keep pushing for that career as an OR nurse. My senior year of nursing school, at that time, people were not going to the operating room to learn, and I pushed for an internship in the operating room. Same refrain from my professors. Got to grow a thick skin if you're going to go in the operating room. The operating room that I finally got into to do my internship, you know, got to have thick skin to work in the operating room. But of course, after graduation, I was still excited. I wanted to be there. I luckily landed my dream job as a new grad in the operating room. It was this groundbreaking program they had never done before at Brigham and Women's in Boston. I was thrilled. And despite my excitement, still had that constant warning in the back of my head. And it caused some major anxiety when I stepped into this role. Am I going to be able to have thick enough skin to make it here? So after 22 years in the operating room, unfortunately, I have witnessed and experienced my fair share of uncivil interactions and behaviors with my surgical colleagues, anesthesia providers, my fellow nurses, surgical techs, ESD, it's everywhere. I've seen it all. But as a new nurse leader, the idea of growing a thick skin to come into this job is one that I strongly dislike. So here's my face when someone says that. Some people say you need to develop thicker skin to deal with mean people. I like to challenge that a bit. So I don't think we should continue to perpetuate that. And so it's my goal to understand incivility in the operating room, figure out how we can improve it, and maybe someday we eliminate it. Because I truly believe that the operating room is one of the most wonderful, exciting, challenging, and rewarding places to work. But that reputation and the reality of workplace incivility needs to change. So, driven by my passion to create a better work environment, I set out, just finished my master's, so I set out to explore what are perioperative professionals doing to foster civility in the operating room. So today, I'm going to share some of my insights from my research that I uncovered, and I hope you can have some key takeaways in your operating room. But now I want to hear from you. What words would you use to describe workplace civility? Civility, yep. Teamwork, yep. Helpfulness, teamwork, respect, kindness, self-esteem, I love it. Kindness, respect, those keep coming back. And the bigger the words get, that means a lot of you have said that. A smile, collaboration, I love that. Mentorship. What was that? Teamwork, collaboration, yeah, for sure. For sure. What else do we have here? Oh, you guys are good. Active listening, teamwork, collaborate, cooperation, integrity, temperament, welcoming. We got to welcome our next generation into the operating room, right? Acceptance. I love it. I love it. I love it. All right. This will be easy. What words would you use to describe incivility? Rude. Nasty. We all know it. We know it. We feel it. Mean, selfish. Yes. Ooh, that's a good one. Yep. Anger, unhelpful, bullying. I'm going to say one thing about bullying. I'm not going to focus on bullying today. That is its own category. It's its own category because that is more the continuous and repetition to generally one individual from one person to another. So I'm taking that out of here today just for context. But yes, it is a form, bullying is a form of incivility, for sure. Mean, unhelpful, gossip, excluding. Ooh, Whoever put that one. Yes, good. Racist, anger, ignorance. I love it. Awesome. Thank you. So you all got it right. I think you hit all of them. So civility is the verbal and nonverbal interactions or communications where someone is kind, they're polite, respectful, courteous, supportive, and encouraging. So think about the majority of your days are civil, right? It's not an uncivil environment the whole time. The majority of your days are civil. We're kind to one another. We're asking if you need help. You're going into the room, how can I help you today? We're also, if you see your colleagues upset, how can I help you today? What's going on? Let's talk about it, right? These are our civil moments where we're helping each other. My favorite one, I don't know if this is a OR thing all over the country or around here, but when you're leaving the OR for the day and you're saying, hey, thanks for a great day. That makes my day, right? You've had a great day, civil environment, love it. It's the outward mindset and actively seeking to understand and empathize with others. Whereas the opposite, incivility, it's more subtle, can be more subtle. It's damaging. Other similar terms that you'll hear for incivility, again, I said we're taking bullying out of it, but lateral or horizontal violence. Those are also in uncivil terms. So it's perceived, remember that. It's a perceived negative interpersonal communication. That's rude, aggressive. How many of you have had someone come in to your patient and they walk right over and they just pull the blanket off because they're just having a bad day and they need to do what they need to do, right? Those aggressive times where they're physically aggressive. Or they're sighing or huffing and puffing. Their tone of voice is aggressive. Yelling and shouting is quite obvious. I had a surgeon who I worked with. It was a busy weekend. I came in on a Saturday morning. I was charged. We generally had one team in the operating room for our weekends. That day we had 3. We had to call in the cardiac team, we had to call in our backup call team, and the regular team was there getting cases ready. So our cardiac team was also, the plastics was coming. It was a big case. So I am on my own after that, trying to triage all these cases and get them into the room. The next one we set up was an emergency, I think it was a GYN case. And the third case we had to set up was a spine case. This surgeon was well known for behaviors, very much reported frequently. And that day, he was upset that his patient was not sitting in the pre-op area. I had no one to sit in the pre-op area with this patient. That patient had also, for context, been on the add-on list since Wednesday. It was Saturday. To add to that, so nothing had changed for the patient. They were not unstable. And to add to that, they couldn't sign a consent. They were completely obtunded. That's how they were. And he needed to call a lawyer at 7 in the morning to get consent. Yeah, you love those moments, right? So I triaged it that his was going to go last. I was going to get the last call team in. He was going last. Well, of course, he didn't like that. And he started yelling and shouting at me on the phone. On the phone, the nurses from the inpatient unit called me later and they heard me say, you need to stop yelling at me. You can come over and we can talk about it. And they heard me say that, and later on they said, good for you for standing up to him. But it didn't stop. He still came over and was shouting at me because his patient needed to be there. These moments still stick with me. I remember how I felt in that moment. So I tried to walk away. I went down the hall towards the room where they were setting up for his case to apologize because now he's in a terrible mood and they're going to have to deal with it. And he's still yelling down the hall. I called my manager later and I told her what happened just so she was aware in case it came back. She rewarded me by putting me in his room on Monday. The only time I've ever refused an operating room assignment. I said, you know what happened this weekend. I'm not going in there. Definitely not. So I am definitely know what that's like. Insulting. Another surgeon that I worked with, I asked my surgical tech friend if I could tell this story. She had been working, they were doing an emergency case. The patient wasn't doing that well. And the surgeon, the vascular surgeon, turned around. He was obviously upset, but he had to take his anger out on someone else. He turned around and looked at her and said, "You are a disgrace." What did she do? She didn't do anything. And we still talk about how he behaved in that moment to this day. So again, just to show, it sticks with you, right? Other ways that incivility shows its ugly head is through gossiping, belittling comments, undermining your colleague's professional credibility. So saying, oh, so-and-so, they're just not confident. They're never going to get it. Instead of being encouraging and supporting them. So another way, the nonverbals. I love this. These are my colleagues up here, Henry and Marcio. I said, guys, can I take a picture of you? And you guys pretend you're having like an uncivil interaction. Does it look like they're giggling? But it's that look, right? See those looks that you can get? The eye rolling, that look across the table, or the famous slamming of the instruments, right? We know it, we know it. There's another time that it seems so minor, but neglecting to go in someone's room. You know they need help, but maybe you've seen someone say, I'm not going to help them. That is an uncivil behavior. Or I was a traveler at one time in my life, in my 22 years. And I was working at a place where I was a newer OR nurse. It was my first travel assignment. And I didn't know everything. So I was in a case, a urology case. I wasn't overly familiar with it. But when we were getting started, the surgeon looked at me and said, well, you needed X, Y, and Z. I don't remember what it was. And I went, okay, I'll go find it. And I searched, and I searched, and I searched. There was one nurse who was hiding that piece of equipment that I needed. You're a traveler. You make more money than me. You can figure it out, right? That lack of action, omission of information, all of these interactions break you down emotionally. Okay? Sorry, that's the uncomfortable part. Maybe we'll look up from here. All right, I love this. I love this quote. Civility is the art and act of caring for others. Does that make you think of nursing? The ANA definition, I'm not going to read you the whole thing because it's quite long, but it starts the art and science of caring. Nursing is the application of civility, right? We need to do it to each other. So a civil work environment, it's essential and foundational to nursing. And it's been shown that nurses who embody civility provide a higher quality of care. They are able to communicate effectively, and they utilize their professional skills to their fullest potential. Now remember, we all have our days. It's normal, we're human, we're not perfect all the time. But I think even when it's important to understand that when you have those challenging days, that it's hardest to maintain civility, you need to remember that's when you're starting to put your patient at risk. All right. Incivility doesn't come without costs and consequences. So incivility contributes to inflated costs of healthcare, and it may be overlooked that cost may be overlooked by healthcare organizations. The cost of incivility is underestimated. It's truly intangible. You can't see every interaction and how it affects someone. It's internal, it's internal, right? And there's this big hidden cost associated with it. We see it in when you have been exposed to uncivil behaviors, there are cognitive impairments, psychological harm, those stories that stick with you forever. That's your psychological harm that comes with it. In the moment, your mental energy is diminished. You know those moments? You're like, all right, I'm deflated now. And you're at higher risk for making mistakes. Now, a bigger cost is it increases turnover rates. Turnover is a huge cost in our healthcare system. It increases absenteeism and it decreases productivity overall. I know we all want to be efficient and get our work done and be able to give care to as many patients as we can, but it will decrease productivity. Uncivil behaviors influence 71% of medical errors. And uncivil behaviors increase mortality in 27% of cases. Workplace incivility can also impair an employee's support for innovation and collaboration. You're not going to want to work with your colleagues, right? If they're not being kind to you, you're not going to want to work with them. And whose insurance rates are not rising? Every year mine goes up. I don't know about you. Every year mine goes up. And in a country where healthcare costs are soaring, we need to start considering how this impacts not only the care we provide, but the cost of our healthcare, the equity in our healthcare, and access to healthcare. So I think the operating room perioperative environment is unique. A lot of these statistics that I've talked to you about so far are general healthcare statistics. But the operating room, I think, is a little unique. It's different. We have complex, dynamic teams. We're fast-paced, unpredictable, high pressure, right? Unstable, in some surgeries are unstable, some are not. We have good days and bad. Interdisciplinary, interprofessional, and there's that medical hierarchy composition of teams. We also have differing opinions and values and practices, and we all need to come together and be a team. But our teams fluctuate throughout the day. So who you start with in the morning may not be who a couple hours from now is in the room with you. Sometimes it fluctuates every hour. It depends, right? Sometimes you're putting cases in other rooms and the surgeons have different teams in every room. It depends on the day. Or you're the break person and you got to walk in and you got to become part of that team right away. So even more so, the majority of our interactions are among each other. A lot of our patients obviously are asleep, some are awake, but the majority of the time, these interactions are among each other. So, oh geez. I want to know, have you encountered incivility in the OR? This is another one of my PAs. It's like, can you roll your eyes for me? We don't want to see your eye. Roll your eyes. She goes, oh, I have a great eye roll. All right. I really want to see a no, because otherwise this is 100%, right? We're looking at 100% of you. I know there's more than 11 of you, so, but those of you who are responding are saying, absolutely, I've experienced this. Nobody's OR is perfect. All right. So not surprisingly, our statistics in the room are pretty darn close to the statistics that are out there. So 97% of perioperative practitioners have succumbed to or witnessed disruptive behaviors at least once a year. But on average, they're seeing, witnessing, or experiencing 61 incidents per year. And of that, 85% of OR nurses experienced incivility. And this is just to drive it home a little bit, that many studies continue to tell us and to substantiate those statistics support that 73 to 97% of perioperative providers experience incivility. Some up to 6 negative acts daily or weekly. You work 5 days, every day you're experiencing one, right? How's that affecting our patients and our care? How's it affecting you? So all this talk about civility, it's interfering with my constitutional right to yell at my coworkers, right? But actually, it's interfering with your right to take good quality care of your patients. So in 2021, the American Association of Nurse Anesthetists, the AORN, and ASPEN came together and made a position statement on workforce civility. And they're calling for comprehensive policies, interventions, accountability for uncivil behavior, and maintaining civil behaviors in the perioperative environment. This is our call to action, everyone. So it's 2024. I want to know, what are we doing? If it's still there and it's still prevalent, what is the research showing us that is working? So I set out to find out what interventions were working. We have a new generation of practitioners coming in that are not going to accept this, right? The change starts here. It starts now. We bring in new generation and we teach them how they can deal with uncivil behaviors so that we can stop it. So in my literature review, we find that in 2018, they're calling for a combined approach. 2019, we're saying we need to put together multiple effective strategies for this to work. We need to adapt our behaviors, and we need some role models and advocates out there. 2021, we have a position statement. Overall, the literature is saying we need a culture of civility. We need to have a code of conduct, consequences for uncivil behaviors, a reporting structure that's confidential, and an advocate. We have an ombuds where I work. They're great advocates. What I don't see much of is support for us, the victims and the bystanders of these uncivil behaviors. And they're saying SIM is extremely important. So of course, to have all this, you need your organizational leaders' support. And I will say that Boston Children's, we do have quite a bit of this in place thus far. It's by far the most civil operating room that I've worked in my 22 years. So I'm really proud to say that. Like any good research, we'll have a little theory. Who loves a little theory? This is an oldie but goodie that I use to guide my search. And this is Betty Newman's systems model. And so when you look at this model, it's meant to be in that middle portion, that structure is our patient. But let's put ourselves there. Let's put us as providers there. And around that is this force field, if you will, of lines of defense, lines of resistance. And then to the left, you can see over here, there's some interventions. And so there's primary intervention, primary prevention, secondary prevention, and tertiary prevention. But what I actually found was that the work that we're doing is only in one part, primary prevention. We have a lot of work to do to make this better and to help us be able to deal with it. So the primary prevention is reducing the number of stressors or reducing the number of uncivil acts and building up our defenses. So what we found is that the interventions focused on 3 areas: self-efficacy, promoting self-efficacy and confidence, increasing awareness. A lot of what we've done today has tried to increase your awareness about incivility, what it looks like, and enhancing communication skills. So, let me turn my page. Awareness increases knowledge of workplace civility. And with that, you want to educate providers on the link between incivility and patient safety, as well as how it affects patient outcomes. We want to teach what unprofessional behaviors look like, so you can point them out and be able to increase it will increase the likelihood to intervene and report, important report. So a lot of the interventions that people are doing can be done virtual or in person. A lot of these were done during the times of COVID, both effective. So any way you want to do it, it's effective. So, but again, prevalence, outcomes, coming up with scenarios of uncivil interactions and teaching the proper chain of command for reporting incidents. In England, they've done some great amount of work in civility in healthcare in general. They have this workshop, it's called Civility Saves Lives. It's an iterative workshop, I think it's 3 or 4 workshops they do to help build awareness and self-efficacy. So if anyone wanted to do a plug and play, that's a great one right there. So Civility Saves Lives. Then, I love this one. This is really unique intervention that surgeons did in ASC. They wanted to decrease the number of uncivil behaviors. So all they did was print out these signs, the one you see here, put it up on the wall. They didn't tell anyone what it meant. No one knew what it meant, but you know what it did? It gave the perception that someone was watching them, right? There's no cameras there. It's just a sign, just a sign. But that one thing triggered a perception of being observed. So even just a sign can increase awareness in an operating room. It's incredible, actually. It's this subconscious thing that happens, right? So overall, increasing awareness and knowledge of uncivil behaviors enhances a perioperative provider's comfort and confidence to recognize situations where acts of civility may impact our patients. So knowledge is power, right? Just educating, knowledge is power. And it empowers our staff to get involved in the change as well. So include your staff. Self-efficacy is the belief that one can achieve a certain behavior, has the confidence to control their own behavior or social environment. So those of us who possess good coping skills are able to deal with these situations better. By increasing self-efficacy, you are more likely to address incivility. So training providers to cope or respond through role play, they become more confident, they can communicate more effectively, and when they're witnessing uncivil acts, they're more likely to intervene. So another way to do this is cognitive rehearsal training, which is some modified responses. And we're going to talk about that a little bit more. So cognitive rehearsal training is taking a scenario in a psychologically safe environment, civil environment, and you're going to make a response in your head. This helps you develop more positive thinking and behaviors. Take it, I think Sarah talked about that pause and taking a moment. Think about it ahead of time. How am I going to deal with these situations? Train your brain, right? Your brain's working out here. So what they do is they'll read a scenario, practice responses in your head. And that response, you're going to focus on responding respectfully. Sometimes it's hard to do, right? It's hard to do, but it's important. You give respect, you're more likely to get respect back. You've given a disrespectful response, you're more likely to get a disrespectful response back. So I want to hear from you. I have a couple scenarios I'm going to read for you. So the first one is you're setting up the room. Just come back from dropping your patient in the PACU. Surgeon comes in. I had this one surgeon who would come in all the time. He would put the mask in his mouth. He'd come to the door. He'd open it. He'd go, "You ready?" I loved him, but boy, did I not like when he did that. So the surgeon comes in, same thing. "You're ready, right?" You have literally walked into the room. You've opened the pack. You're not ready, right? So you politely say, "Not quite ready." Not quite. He rolls his eyes, sighs, walks out. Another 1 hour turnover. Great. How do you respond? You can share it up here. You can, if anyone wants to, think respectfully. Stop, pause, think about it. How are you going to respond in a manner that's going to matter? Because let me tell you, I don't want to hear it again. Yeah. Yeah.
It's like you're being baited.
Yeah. There's a good, you can respond. What are we getting up here? If I can see it, ignore it. No. I think it's important that you actually share how that behavior affected you. It's important that they know. So here's an example. Ooh, would love your assistant to make it quicker. I knew you guys were going to say this. Yep, I can call you when you're ready. That's a good one. So how about this one? Let's test this one out. Let's test this one out, right? Let's call them on the behavior. Hey, when you rolled your eyes and you sighed, I recognize you're frustrated with the turnover time today, but those negative comments made me feel unappreciated. Make it about you. How your behaviors are affecting me. So with that, that's good observation. Thank you. That's the other part of this. Thinking about when you're going to respond. There are good times to respond in an operating room, and there are times where you're going to take it up with them later, right? Yeah, there is a delicate situation. So in this situation, I'm going to say I went out to the pre-op area and I saw him, and he was, "Hey, you got a second to talk? I need to talk to you for 2 seconds. I know you're frustrated with this turnover, but this is how it affected me and our team. Try it." I tried it recently with one of our surgeons. One of the nurses said, "I feel like he just isn't hearing me and respecting me." I brought him in a room. I'm the manager, and I said, "Hey, I don't want to have this conversation with you. I want my nurses to have this conversation with you. Are you comfortable if I come bring her in and facilitate this conversation?" Do you know, he was so thankful that we went directly to him instead of her holding it in. He's like, "I want my team to work together, and I am so sorry that me ignoring what you're telling me for blood loss is affecting you this much. I didn't realize that you felt disrespected when I ignored you, when you told me the blood loss was this." And I said, "No, that's not what it is." He didn't know, but he wanted to hear from her and fix that relationship. I mean, maybe not everyone is going to be that way, but we have to start somewhere, right? We have to start somewhere. All right, do we have time for one more? We don't, so I'm going to keep going. Right? Am I 3:30? Goodness, you guys, I didn't know I could talk this much. Wow. All right, so I'm going to buzz through this real quick. Communication skills are absolutely vital for the health of a team. Being able to kindly and effectively de-escalate potential uncivil behaviors is crucial in maintaining civility. Miscommunications at times can mean life or death. So some ways to do this are assertiveness training. Assertiveness is being able to express your own desires, your rights, your feelings without rejecting the other person or infringing on the other person. So teaching the right way to assert yourself, it demonstrated a positive correlation between workplace civility and assertiveness. Another way to do this is simming. Simming is so important. Going through these exercises with planned de-escalation phrases, cue cards. Give your new people cue cards and say, hey, if you encounter this, start memorizing these responses. This is how you're going to respond to de-escalate. So when we educate, increase awareness, you become more effective and confident in identifying and intervening in situations. We'll find that there's improved safety culture, more reporting of disruptive behaviors. That's important. If reporting is important, you may feel like a tattletale, but if it's someone that has repeated behavior and I'm your leader, I want to know about it. There's where the bullying comes in, right? And then you have increased chances of intervening in the future. So quickly, does anyone in their organization have a strategy to address incivility? A specific strategy? Or do you do anything in your operating room? Do you teach responses? Are we teaching or educating? It's my colleague Molly and Patrice in their very happy civil environment at the time. Yeah. Yep. Mm. Yep. Mm-hmm. Great. Yeah. Yeah. Right. Great. I love that. Right. Exactly. Thank you for sharing that. Thank you. So I am out of time, but let me close with this. So it is unmistakable that there is a link between incivility and patient outcomes. Statistics continue to show it. And it is time for us as nurses on the local level and organizations to come up with comprehensive strategies and multiple interventions to combat this. Knowledge is power, and empowering perioperative staff's involvement in change is essential. Education, making this a yearly competence. If you are a nurse educator, consider adding civility training as your yearly competence. It is important. Periop 101s, anyone who teaches Periop 101, do you teach communication skills? Do you have cognitive reversal training? And then discuss it often. Being aware that it exists is the first step. So it's time for a change. Time for us to turn the negative reputation of the operating room around. Time for us to eliminate that refrain. You have to grow thick skin to work in the operating room. Because I like to challenge that, and I like to say the operating room is an amazing, exciting place to work where we make a difference. We deliver high quality care and make a difference in our patients' lives every day. So thank you.